Pharmacy roles and specialties in different settings are going to be discussed in this video. So sit back, relax, and enjoy this video as you learn today.
Clinical pharmacist. What is the clinical pharmacist, or what are the roles of being a clinical pharmacist? Clinical pharmacists practice in healthcare settings where they have frequent and regular interactions with physicians and other health professionals, contributing to other of healthcare. Clinical pharmacists are educated and trained in many direct patient care environments, including medical centers, clinics, and a variety of other healthcare settings. What does clinical pharmacists do? What are the functions of clinical pharmacists do? Number 1. Assess the status of the patient's health problems and determine whether the prescribed medications are optimally meeting the patient's needs and goals of care. Number 2. Evaluate the appropriateness and effectiveness of the patient's medications. Number 3. Recognize untreated healthcare problems that could be improved or resolved with appropriate medication therapy. Number 4. Follow the patient's progress to determine the effects of the patient's medications, his or her health.
Nuclear pharmacy or radiopharmacy is the area of pharmacy practice that deals with the preparation of radiopharmaceuticals which are used in the treatment and diagnosis of different diseases like bone marrow disease, tumors or cancers, and heart disease. A nuclear pharmacist's job is to make sure that the right and safe dose of a radiopharmaceutical product is given to the patient. They are also responsible for compounding, ordering, and safe handling of radioactive materials, controlling the quality and purity of the product, filling of prescription orders, and providing drug information to other health professionals. A nuclear pharmacist must be a fully qualified pharmacist. They need to undergo extensive trainings and qualifications in nuclear pharmacy practice. Nuclear pharmacist serves a vital role in helping other nuclear medicine staff and ensuring the safety of the patients who are undergoing nuclear medicine procedures.
So, community pharmacists are the ones who work in the community setting. Sa mga towns, villages, cities. Maaaring sila yung may-ari ng pharmacy or kaya nag-work sila sa mga community pharmacies or sa local healthcare centers. Ang community pharmacist ang pinaka-accessible na healthcare professional sa public since nakapag-provide sila ng personal patient advice about sa health and medication sa pamamagitan ng pagpunta ng pasyente sa community pharmacy without any appointment or tinatawag natin na walk-in basis. Before, ang main role ng community pharmacist ay mag-dispense ng medication based sa prescription ng isang doctor. But over time, nag-evolve ito at lumawak ang sakop. Katulad na lamang ng una ay ang mag-process ng prescription kung saan i-check ng pharmacist ang prescription na ibinigay ng doktor sa pasyente at ipe-prepare nito ang medikasyon na nakalagay dito. Ikalawa ay ang pag-check ng drug interactions kung saan sinisigurado ng community pharmacist na tama ang dose at medication na nakalagay sa reseta sa demographic background or age ng pasyente at medical background nito. Kagaya na lamang ng kung ano ang mga inintake na gamot nito in the past and kung ano man ang known allergies ng isang pasyente. Dispensing of medicine, kung saan dito na nga pumapasok yung pagbibigay ng instruction and information ng isang community pharmacist sa pasyente about sa medication na ititake nito. Dapat ay ang providing advice and promotion of healthy lifestyle, kung saan natutulungan ng mga community pharmacists ang mga patients sa pamamagitan ng pag-encourage sa mga ito na magkaroon ng healthy lifestyle, gagaya na lamang ng pag-iwas sa bisyo, tamang pagkain, at
Consultant pharmacists are also known as senior care.
Ano nga ba ang consultant pharmacist? Ang consultant pharmacist ay ang mga licensed pharmacist na nag-work as consultant. Sila yung mga nagbibigay ng expert advice on clinical pharmacy, academic pharmacy or practice, public health pharmacy regarding sa safe na paggamit ng medication and productions ng mga gamot. Pati na rin yung mga provision ng pharmaceutical services sa mga medical institutions, sa mga hospitals, sa mga universities, and syempre pati na rin sa mga individual patients nila. Sa United States, ang focus ng isang consultant pharmacist ay yung pagre-review at pag-manage ng mga gamot ng mga senior citizens sa mga nursing homes. Katulad ng iba pang mga pharmacists, sinisigurado rin nila na appropriate, effective, safe, at ginagamit sa tamang pamamaraan yung mga medications ng mga pasyente nila. Ang isang consultant pharmacist ay especially trained para mag-assist ng mga long-term care patients para maayos na ma-take yung special medications na prescribe sa kanila. Ang mga long-term care patients ay karaniwang mga senior citizens, mga pasyente na kailangan na ng assistance sa basic daily activities nila. So, paano naman maging isang consultant pharmacist? Para maging isang consultant pharmacist, kailangan graduate ka ng Bachelor of Science in Pharmacy at dapat nakapagtapos ka ng Doctorate in Pharmacy. At syempre, kailangan din na meron kang experience sa pagiging pharmacist. So generally, ang role ng isang consultant pharmacist ay yung magbigay ng expert advice and sila rin yung nag-lead para mag-train ng mga kapwa nila pharmacist or yung mga pharmacist na mga bago.
Veterinary pharmacist. What is veterinary pharmacist, or what is the role of being a veterinary pharmacist? A veterinary pharmacist is an animal health professional with a doctoral degree and advanced training related to the use of pharmaceutical products. This duty may vary depending on the specific nature of their employment. Example of academia, for a corporation, or for a regular agency. What do veterinary pharmacists or function of clinical pharmacists? Veterinary pharmacists may be involved with dispensing medications that have been prescribed by a veterinarian, providing consultations on dosage and side effects, providing compounding services, ensuring that all regulatory directives are properly followed, taking inventory and supervising pharmacy technicians or other support staff members. Those working in regulatory roles may be involved with testing, research, education.
Next pharmacy role, we're going to be talking about hospital pharmacy. Hospital pharmacies are the pharmacies that we usually encounter in a hospital. They are responsible for the monitoring of the stocks of medicines in a certain hospital. Aside from that, they are also responsible for the purchasing, manufacturing, dispensing, and testing quality medications along with their pharmacy assistants and pharmacy.
So let's move on to ambulatory care pharmacy. What is it? Ambulatory care pharmacy practice is the provision of integrated, accessible healthcare services by pharmacists who are accountable for addressing medication needs, developing sustained partnerships with patients, and practicing in the context of family and community. This is accomplished through direct patient care and medication management for ambulatory patients, long-term relationships, coordination of care, patient advocacy, wellness and health promotion, triage and referral, and patient education and self-management. Ang ambulatory care pharmacist ay isa sa mga mahahalagang miyembro ng healthcare teams. Ambulatory care pharmacists are medication expertise who partner with patients para matulungan silang i-improve ang kanilang kalusugan. Ambulatory care pharmacist acts as a patient advocate, the medication therapy management, promotes wellness, helps educate, and helps patients self-manage their chronic diseases. They may also work in both institutional and community-based clinic involved in direct care of a diverse patient.
Ang mga specialty pharmacists ay nakafocus sa mga complex na sakit na nagre-require ng mga complex medication kagaya na lamang ng cancer, or rare genetic condition. Sama rin sa role ng pharmacist na mag-monitor ng medication ng patient and maaari din silang mag-offer ng extensive patient counseling para mas maintindihan pa ng patient kung ano ba yung mga medication na ini-intake nito. Pharmacists must effectively communicate with prescribers to ensure optimum care. Pwede rin naman na nasa retail pharmacy setting o specialty pharmacy providers ang mga specialty pharmacists na nagpo-focus sa pag-dispense ng mga complex medication para sa mga
Compound pharmacy. Compounding pharmacy can often conduct drug formulas that are specially tailored to patients. For example, liquid versions of medication that are normally available only in pill form for patients who cannot swallow pills. The traditional role of compounding pharmacies is to make drugs prescribed by doctors for specific patients with needs that can't be met by commercially available drugs. And also, compounding pharmacies mixes drugs to achieve the correct dosage, strength, form, formulation, and even flavor for customized.
Internet pharmacy. Rules of being an internet pharmacy. Online pharmacy is a pharmacy that operates over the internet and sends order to customer through mail, shipping company, or online pharmacy web portal. Being an online pharmacist does not typically interact with customers, may supervise technicians and oversee operational activities including data entry, order fulfillment, and shipping companies. Function of internet pharmacy. Online or internet pharmacy compounds and dispenses prescribed drugs for physicians, instructions for online or mail order subscriptions ordered. Manager a high volume of prescriptions. Internet pharmacy sells prescription drugs only with a prescription. Some do not require a written prescription, as prescriptions may not be necessary in some countries. Ensuring the supply of medicine.
Informatics. Marahil bago ito sa inyong pandinig. Marahil yung iba nagtataka na meron palang iba't ibang uri ng work field ang isang pharmacist na ating pang tatalakayin sa mga sumusunod. Ang isang pharmacist kasi hindi lang ito yung mga nagtitinda ng gamot sa botika. So, as a pharmacy informatics, we take or we upgrade the healthcare field into a new level by making the practice of prescribing and administering medication more precise. This field is so interesting as we apply both medication knowledge and computer science, information technology solutions including its acquisitions, storage, analysis, use, and dissemination to improve patient outcomes. So, baka yung iba sa inyo nagtatanong kung graduate or licensed pharmacist lang ba ang pwedeng maging pharmacy informatics. So, to make up your mind, the answer is no. If you are a graduate of BSIT or Bachelor of Science in Information Technology or other engineering field related studies, you are suitable here. Kailangan mo lang mag-take up ng pharmacy school, be a licensed pharmacist, at itong pharmacy informatics doesn't require any residency. So, what do we mean by residency? Residency is a training program specifically created in pharmacy practice to allow us to apply what we obtain knowledge and skills in the academy to the real patients, situations, and settings. It is added as a credentials and sometimes basis of how much our salary will be, because employers seeks for expertise. On the other hand, the American Society of Healthcare System Pharmacists issued a pharmacy document called the Statement on
pharmacist's role in informatics. The statement reaffirmed the responsibilities of the pharmacist and the pharmacy informaticist in healthcare informatics. The society outlines 5 broad areas of responsibilities for this role. Number 1, information management. 2, knowledge delivery, data analytics, clinical informatics, and change management. So now, kaya mo bang gampanan ang mga nagulong responsibilidad dito? Tara na at maging kabaro na mo. Padayon, clinical pharmacist.
A military pharmacist. This group of pharmacists handles the security of a medical operation and responsible for the management of medical supplies, and in general, in clinical support. And in addition, they act as the advisor to field medical unit commanders on all pharmaceutical matters including storage, distribution, security, prescribing, and dispensing of medicines. And as unmilitary, they also has to learn and to know what safety regulation is for them to help a military reinforcement. Let's pretend like on wars, crime, actions, or battles.